evening, good morning, good afternoon. Where do you live, Dr. Clarke?
Currently in Portland, Oregon, but
Portland,
I move around
Oregon.
a lot.
Right. So Dave is afternoon, Rose is early morning, bless your heart. I'm in the evening. This is TMS Roundtable. I am Dr. Tova Goldfine, and I'm always so happy to be here. I'm going to introduce Rose Hoy, my wonderful co-host and partner in this professional, wonderful world we live in, and she's going to talk a little bit more and introduce our guest today.
Good morning, everyone from Melbourne, Australia. Today we've got Dr. David Clarke. Now, he's a gastroenterologist by background, and he's also a doctor who's been aware of stress illness for a long time and works with patients or sees patients that have got a stress illness but showing up as gastroenterology problem. He is also president of PPDA Association. Now, hopefully he will give us a bit of a broad outlook on what that association does for people that are suffering from chronic pain, because it's a very important association and it's an area that we can all tap into, get information from, and get some feedback about how the healing journey can commence. Now, please, Dr. Clarke, would you give the audience a bit of a broad overview for anyone who hasn't ever met you before, about your background and how you came to write your book independently, separately from all those other doctors, and came to the conclusion.
And it's translated to Hebrew.
That's right. That's right.
Yeah,
I've got a Hebrew copy around here somewhere.
Thanks.
Yeah, well, thank you.
On.
Thank you so much for inviting me onto your wonderful program. And yeah, I started this in work in 1983 when I encountered a patient who had a serious physical illness that had baffled two universities, and I accidentally stumbled on the fact that she had a severe long-term stress she was coping with, and I didn't know what to do with that information. But I contacted a psychiatrist who had a strong background in mind-body disorders, who completely shocked me by curing the patient with less than 3 months of weekly counseling sessions. And this woman had been severely ill for years. So I thought, that's pretty amazing. I should learn something about how she did that, so that when I encounter a patient in the future, I'll have some idea what to do. And never imagining that I would see more than a half a dozen such patients in a year. But I quickly learned when I got into practice that if I knew what to look for, I was encountering 5 or 6 of these patients every week. And it turned out to be over 7,000 in the last 38 years. And I eventually felt confident enough of what I had learned to write a book about it, which is called They Can't Find Anything Wrong. It was published in 2007. And is selling more copies now than it did when it first came out.
Rose and I are talking about it. That's why.
Okay, yeah, that must be it. And it is translated into Hebrew.
And what other languages? Spanish?
No, just Hebrew and English so far. I would love to have it in Spanish because there's so many people that speak Spanish that could benefit. But not yet. And then a second book that I was the lead editor for is called Psychophysiologic Disorders.
It's an amazing book.
And it's 16 total contributors from 5 different countries. And it's written for professionals, but I insisted that everybody who wrote do so without jargon, so that we could have the mental health professionals could read the medical stuff and vice versa. And the fringe benefit of that is that there's no 6-syllable words in it, so that anybody, even non-professionals, can read it. And I'm hearing that a lot of therapists are prescribing it for their
it's a fabulous book.
Science-oriented patients.
It's a fabulous book. Alan Gordon's there, Georgie, some incredible chapters. Incredible chapters.
Thank you.
Yeah. I'm going to put it up on the Facebook page.
It took 4 years to, it was like herding cats, to get everybody to write their chapters. But they came through. They eventually, when they finally sent me their manuscripts, they did a wonderful job. And I was really, really proud of the effort that they made. So that's, and that's the books, but there's also an organization, the Psychophysiologic Disorders Association. The easiest to remember website is endchronicpain.org, but it's also at
And
ppdassociation.org.
chronic
And
pain.
it's the only nonprofit in the United States and one of the few in the world that is devoted to mind-body conditions. And
I
we
feel
offer
so,
a
I put it
range
on,
of
I feel so proud. I feel so proud to have that because Rose and I lean on that for the bibliography and for resources. It's in our joint website. It's in my website, and it's an unbelievable resource. It's really it helps us be better in
Thank
what we
you.
do.
Yeah, we're very proud of the fact that it is very strictly evidence-based. We don't put anything in there that is, somebody's just made up because it sounds good. We insist that there be scientific evidence behind everything that we recommend and promote, because that's the way to gain the trust of the healthcare profession, that
Yes,
what we're doing is scientifically valid and that we can change outcomes, lower costs, improve the health of patients who suffer from this. And it's 40% of everybody who goes to see a physician. So it's a huge number of people,
it's a
um,
massive number, isn't it? Yeah.
millions upon millions
Mm.
in the US alone, and of course worldwide. But another fringe benefit a lot of people don't recognize is that these patients are tremendously frustrating for healthcare professionals because few of them have had any formal training in how to approach this. So they end up getting very frustrated by not being able to diagnose and treat this properly, and they don't know what to do. They want to help their patients, but they don't know how. And it ends up that when they see a patient with this problem on their list for the day, they just, their heart sinks, they beat their head against the wall. But by using these techniques, which are, not especially difficult or complicated, they can take a very frustrating individual and turn them into somebody who's very
Yeah,
rewarding to work with. And
yeah,
it,
good
it
point.
one physician who learned these concepts came up to me at a conference and said, these ideas have put the joy back into my practice.
And to think if every doctor got adept at the um, the adverse childhood experiences research, they would help their patient not feel bad about having a trauma or feel wrong about trauma is part of life if they understood about trauma, because so many people do have the trauma and they're in chronic pain. And if their doctor could be, I understand, let's figure out, I may not be able to help you, but so I imagine that study has helped you personally start the PPDA and feel like you have a beginning, middle, and end to what you're doing.
Yeah, the Adverse Childhood Experiences study came out in 1998, and it was a slow start. After that came out, a lot of people were somewhat shocked by it and taken aback and found it difficult to believe, frankly, the level of impact. I mean, if you come up as a public health investigator with a phenomenon that increases the risk of disease by 40 or 50%, you've got a publishable paper. You've found something important.
Yeah.
And the ACEs paper came up with things that, they found that if you had 4 or more ACEs, it could have a 1,000% increase or a 500% increase in various adverse health outcomes, and not just one or two, but the list is up to a couple of dozen now that it can have a huge impact on. And one of the things that we teach as a core of our approach is what to do about the long-term impact of adverse childhood experiences, or ACEs. How to address the personality traits that Dr. Sarno spoke about, and so many others have spoken about, Dr. Schechter as well. Those personality traits that come out of ACEs experience, perfectionism and goodism, and being extremely self-critical, and so many others, low self-esteem, poor self-care skills, those can be addressed and turned around. And when they do, stress level goes down, physical symptoms improve. And that's just one of the techniques that ACEs has helped us with.
Wow.
And this
Yeah.
led to a whole lot of other research as well. There are now scores of studies based on ACEs that have revealed impacts on many, many more areas. So it really is should be a core skill for medical and mental health professionals to learn how to diagnose those long-term impacts and reduce them as well.
Yeah. Well, a lot of healthcare professionals haven't been exposed to attachment theory either, so it makes it very difficult for them to see how ACEs would be connected to chronic pain.
Yeah,
From
attachment
the
theory is very important. Anybody who's familiar with it, it was originated by John Bowlby in the mid 20th century. One of the great honors of my life was to speak at the Bowlby Institute about these ideas, ACEs and PPD. The director of the institute was sitting in the front row, furiously taking notes. It was, just in the room. There were 175 of the best therapists in the UK
Were
in
you
that
nervous?
audience.
Were you nervous? Did you have a rash, or did you?
No, but I was a little bit because I wasn't sure, how the presentation was going to go over because I'm talking to a room full of people who work, at a very expert level with mental health conditions, and here I am talking to them about how
Amazing.
understanding the reactions in the body that their clients are having can be an important window that they might never have utilized before. And how is that going to be accepted? But it turned out that it went over very well, and it usually does with mental health audiences that they weren't, again, they aren't formally trained necessarily in how to address somebody who is physically symptomatic as opposed to having a mental health condition. So it's something that they're not comfortable engaging with typically. And that's why we have this big blind spot. The medical professionals don't hear about the mental health side of this, and the mental health professionals aren't comfortable with the physical symptoms. But if we can bring them together in a collaboration, we get tremendously good outcomes with these patients. And that audience at the Bowlby Institute absolutely could see that. They could see that they could engage with their patients' physical symptoms and use that as a way to learn more about their clients, learn things that their previous training might not necessarily have prepared them to understand.
Yeah. Well, if you think about doing medicine, for example, you'd wonder why you'd bother about attachment theory. It's sort of more of a not mainstream, but in actual fact, it is. It's being human, isn't it? That we need to acknowledge our
Yeah,
attachment. Yeah.
yeah, no
Yeah.
question about it. And it is yet, people with maladaptive attachment styles, again, that's another long-term impact of ACEs. Those attachment styles that create problems for people are a direct outgrowth of their adverse childhood experiences. And again, by understanding the pathway from the ACEs to the maladaptive attachment styles, we can help people understand how they got there.
Right.
One of the comments that I'm fond of making for people who are extremely self-critical or perfectionist is that people are not born that way. They have to be taught. And if you can figure out, who taught you and
Right.
how did they teach you to be so
Right.
self-critical? How did they, make you feel like your best efforts were not good enough? How did they implant these extremely self-critical behaviors? That is for my patients, the most effective way of reversing
Right.
those personality traits.
Right. Well, I want to do a little plug because Rose and I, and this was Rose's idea, that mostly everyone we speak to, whether they work with us or not, we have them watch All the Rage because we find it to be a foundation of clarity and understanding. And of course, Gabriel Maté was in that movie, and he is now big on the trauma, but he says this, and then a couple of our amazing social workers who worked with Alan Abyss, Dr. Abyss, talked about attachment. Marvin Scorman just speaks beautifully about attachment. And what Gabriel Maté says, not in the movie, he was interviewed by Michael Galinsky, but he talks about when we're children, we had to choose authenticity or attachment. So we gave up. Am I saying it right, Rose?
Yes, you are.
Authenticity.
Our own authenticity for the sake of attachment, for the sake of keeping our caregivers close to us. Yeah.
So we lose ourselves. We lose our identity as we're trying to regain it, and then we're confused, but we're a bit traumatized. And then some of us come out okay because we're resilient. Some of us, they stay in that, whirlwind of attachment.
Yeah, no, that was what I said to the, and actually, I'm in All the Rage also. I got a whole minute and a half in All the Rage, which was great.
I remember.
Delighted
you were wearing a suit and a tie.
Delighted to be part of it. Yep. Well, I wasn't sure what kind of interview it was going to be. Ended up being at Michael's home, but it was a fun experience. And I was glad to see that I made the final cut, so that was fun.
Yeah.
But one of the things that I remember telling the Bowlby audience was that I wasn't going to try to tell the Bowlby audience anything about attachment theory because they all knew more about it than I did. So I didn't have anything to teach them about that. But what I did try to share with them was a parallel sort of experience, which is that children in ACEs environments learn things about themselves that aren't true. And this is something that I try to understand about all of my patients. What did they learn about themselves as children that isn't true? Did they learn that, for example, it's their job in life to solve the problems and difficulties and to provide support for those around them, that they need, even as children, to focus on the needs and the problems of the people around them, rather than what they should be doing as children, which is to spend the majority of their time focusing on their own
children,
needs.
Yeah. So here's a question from, I'm going to interrupt you because I'm so happy when Scott comes to our show. I know he's on a healing journey, and he's asking you, what are the techniques you favor in order to alleviate chronic pain?
Well, it depends on identifying the psychosocial issues that a particular individual is struggling with. I go through a step-by-step process to try to identify what's going on at the present moment in your life, whether it's work or neighbors or relationships or marriage or children or parents. What is going on? Are there boundaries that need to be set there? Are there changes that need to be made? Then I'll go on and look at a person's self-care skills. Are they spending regular time in activities that have no purpose but your own joy? Because many of my patients, that was one of the things they learned, was that they weren't worthy of spending that time, that they didn't get enough opportunities to play as children, and consequently as adults, the idea of just being self-indulgent for an afternoon every week is a foreign concept. I look for the long-term impact of ACEs. How is the person's self-esteem? Do they have a perfectionist side to themselves? Are they so focused on being compassionate towards those around them that they forget to put themselves on the list of people they take care of? And then finally, I look to see if they are suffering from a mental health condition that is manifesting primarily through the body. And this turns out to be more common than these mental health conditions manifesting in mental health symptoms. So these are depression, anxiety, and post-traumatic stress. Somebody's been through a terrifying or horrifying event, and they haven't made the connection between that event and its aftermath and their current symptoms. So I go through all of these things and try to identify. Some people have them all,
Yeah,
or
it's
some people that
true.
just have one.
You're Scott's saying how you're describing him. And
Yeah.
so,
So we need to then once we've identified, that's the diagnosis part. Then the treatment part is to go through step by step and try to alleviate all of them. But very often, if you dig down to the most fundamental um, shift that needs to be made, it's in self-esteem. Because that is a common denominator in people who experienced ACEs. Those ACEs make people feel like second-rate human beings who are unworthy in a variety of ways. But if you can look at the ACEs experience as if you were born in the midst of a dangerous wilderness, which means you found yourself in this terrible place through no fault of your own, and yet you made it out of there. You can give yourself tremendous credit. It's, another analogy is that you were born on the far side of Mount Everest and you somehow climbed up and over
right.
to get to be an adult.
Your
And if you look,
survival techniques can work for you, and then at
that's
some
right.
point you can come out of survival. You're explaining it so beautifully. I'm sorry to interrupt. Continue.
That's all right. And you can be very proud of the fact that you have made it out of there. And you can you can begin to engineer a 180-degree flip in your self-esteem. From looking at yourself as unworthy and second-rate and shameful, you can look at yourself as someone, you'd look at them just as if you met somebody who had in fact climbed Mount Everest. I know two people who have done that, and they're amazing people. And all 7,000 plus of my patients who have made it out of ACEs environments are equally amazing people, because that is a tremendously difficult thing to do.
Yeah. Could I just add
Explained.
to Dr. Clarke's comments, his previous comment for people like Scott? What did you learn about yourself that is not true? What did you learn from your environment that ended up not being true? I think it's the most important fundamental concept with chronic pain, that you've learned that you aren't quite enough, but in actual fact you are enough. So just to add to Dr. Clarke's comment there.
Yeah, it's a huge challenge because none of us has a parallel life that we can compare with.
That's true.
So
yeah.
to look back, many of my patients look back and say, "Well, it wasn't that bad," and
Well,
and
that's frank.
other people have been through worse than I have. So
Right.
and they
Yep.
seem to be okay. So
Right.
I should be
Okay.
okay.
Right.
Here we are. Bring
Right.
Fran up. She's
So
exactly what we've been talking about.
Okay.
well, yeah, it's many of my patients have told me that their childhood was happy, and then we start to talk, and then we start to find these little clues that maybe things weren't quite so rosy as you used to think they were. One of the techniques that's helped a lot of my patients gain some perspective is to imagine a child you care about, either your own child or someone else's, and imagine that child growing up exactly as you did. Imagine yourself, for example, being a butterfly on the wall of your childhood home, and you're watching this kid that you care about try to cope with everything that you did. I just by, I don't see patients much anymore. Occasionally, once or twice a month, I'll get a referral from a therapist who knows me personally, and they'll send a patient who's really struggling and not making progress. And I'll talk to them once, have a conversation via Zoom. And I've had, by coincidence, 2 or 3 in the last couple of months who initially told me everything was fine when they were growing up and we needed to look elsewhere.
Good.
But it turned out it was... one of them, the mother was depressed and the father was a miser. The one thing that she had for herself in her childhood was dance, ballet. She got to the point, as you do in ballet, if you go far enough, that she was ready to go up on toe. You need special shoes for that. He wouldn't pay for them. just ended her ballet career on the spot, essentially. And he could have afforded it. I mean, both he and his wife had solid, middle class jobs, and they had the money to pay for toe shoes for her, but he wouldn't do it because he just, he wouldn't spend money on anything. And the message that sends, you hear again, we see the self-esteem.
Message, yes.
You are unworthy.
Right.
Yeah.
Right.
Yeah. Yeah. Fran, also, it's not so much these major traumas that affect us. It's also those little ones, like that lady that Dr. Clarke's talking about. Probably never spoke about that in all those years until she was questioned in that manner, and she probably never saw it as a trauma. She just saw it as, dad being mean or something like that. So we're not really always looking at, being beaten or anything like that. It's about just the little things that hurt us. And what happens with attachment theory is it's not repaired. None of us are perfect parents. But in the meantime, when we sort of maybe shout at our children or something, but we repair it later on. We apologize, or and we own the problem as our own problem, and then the child is exonerated and they don't feel as though it's their fault. So there are all those little cuts to the heart. So
Yeah, and this was one of the things that shocked me, was that the long-term outcome from what some people call small t trauma as opposed to big T trauma, as far as I could see in my patients, they were essentially the same.
Wow.
That as long as the self-esteem is knocked down on a long-term basis, it doesn't matter how it happens. The impact to the adult is very, very similar.
Yeah.
It is. Yeah.
Yeah. It's so
see,
true.
Fran agrees. Yeah. Yeah. Yeah.
Can you read that, Dr. Clarke?
From Fran, I inherited anxiety from my mother. She
Yeah.
never knew she had it. Several little things for sure.
Yeah.
They can add up. One of the exercises I have my patients do, which is, not, I think everybody that works in this field uses this, but having you write a letter to the parent or parents that caused the problems, not to mail it, just to write it, where you feel you can speak freely and verbalize your thoughts and emotions about this person and not hold back. And frequently, once people start writing, the ideas begin to flow and a lot of memories begin to come back, and you begin to get a more accurate sense of what things were truly like.
Yeah. Could I also add that once the memories come back, they can become integrated. They've been repressed, they've been put away, but then they become integrated. And then a person's self-esteem can rise again out of that. Out of that integration of the trauma, their self-esteem, they can see that it wasn't their fault, because all along they've read it as their fault. So,
yeah, absolutely. Yeah. Once you realize that your being in the middle of that wilderness that I spoke of was not your fault, and that you can give yourself tremendous credit for basically what amounts to the journey of a hero to come out of that wilderness.
Wow.
But you have to recognize the challenge of that wilderness first. The magnitude of the difficulties that you faced back then.
And then you're creating it in your body. You keep creating the conflict over and over again in your body and in relationships.
Yeah, definitely in relationships, and the emotions that you have are being expressed into your body in the form of symptoms. And oftentimes the more that you are able to write down in these, letters to the ACE perpetrators, the more those emotions wind up on the page or on your computer screen, the less those emotions need to go into your body and cause symptoms. Now, it could be in the short term, just the act of writing the letter and the immediate aftermath can stir so many things up that you may get a spike in your symptoms, but it's going to be temporary.
Yeah.
Actually, that's another good comment, really, Dr. Clarke, because patients often, when they come to, say, therapy, they get a spike in their symptoms and they don't realize that the symptoms have been there to hold back
Right.
their repressed
Right.
feelings. So they're going to get a spike. And again, they have to sort of work through it. Yeah. See, Fran, can you pop up Fran's
Yeah.
next comment?
Yeah, Dr. Schubiner's workbook is outstanding, and not everybody's ready to do every single piece of what he recommends the first time they go through it. And a lot of my patients, it took them a while to follow up on the idea of writing a letter to their ACE perpetrators. I remember one woman in particular, she put me off for 18 months. I saw her every couple of months, and every time I would ask her if she'd written a letter to her dad yet, and every time she would say no. And finally, she said, "Look, I'm getting tired of your pushing me to do this all the time. So what I'm going to do is I'm going to write 2 or 3 paragraphs to him, and that's it. And I want you to, if I agree to do that, will you please stop asking me to write this letter?" I said, I don't think 2 or 3 paragraphs is going to be enough, but if that's all you're able to do,
Mhm.
then we'll go with
Uh-huh.
that. And
Start.
no surprise though that once she started writing, she couldn't stop,
Right.
and she ended up with 9 single-spaced typewritten pages that
And
she,
why is it so hard? Why is it so hard to do
uh,
this? Why is it so hard to write? I find it hard as well to journal.
yeah,
Not easy.
it stirs things up, and people survived those early wildernesses by keeping their emotions down, keeping them suppressed, keeping them in a place where they didn't feel them. So to all of a sudden start feeling um, is it's
It's
a
foreign.
whole new thing. It's foreign.
Yeah.
That's the word.
It's like a
Yeah.
new language. It's like a
Yeah.
new
Yes.
language.
Another good phrase.
Yeah. And as our colleagues would say, a new pathway that's foreign, and it feels like that's where the threat is. Even though we want to get away from the threat, we're estranged in the deep part of who we are. And so, we talk about this new pathway we want to build so they can feel comfortable with their feelings and feel comfortable in the lion's den and realize there's no lion, as Alan Gordon will talk about, um, there's no threat there. We have to tell our body, our mind that we're safe, in that group.
Mm. But there was a threat, you see,
There
Tova.
was.
Once there
You're
was a
right.
threat,
You're right.
and the person had to fold up their
Right.
feelings, put them away.
Right.
So, but the shadow of that threat remains in their lives all the
Yeah.
time until it's opened up and exposed. Yeah.
Yeah.
Well,
And if the threat is to your self-esteem, but you don't, as a result of that, you don't have any self-esteem, then it's hard to see what the threat is. It
Mm.
really, it oftentimes needs a conversation with somebody who understands these issues to help people see it.
Yeah. Well, that's true because it's been too hard and too unknown for people, hasn't it? Like when you expose them to that whole idea of that early childhood trauma, as Fran says, but I had a lovely time, because children make it a lovely time no matter how bad it is,
so true. Good
don't
point.
they? Yeah. You're not going to be miserable 24/7. You're going to go out and play or ride your bike or get away from arguing parents or whatever. So you're going to make your life as pleasant as you can. So yeah,
Yeah, yeah, that's right.
yeah,
And you
yeah,
don't have anything else to compare it with, so you don't
that's
know
right.
that there's a different way that things could be.
Yeah,
And you don't have a
yeah,
good sense of how much you have overcome. Until, again, this exercise of, another way to look at it is if I somehow control your mind and I make you raise your own kid exactly the way you were raised
Such a good point.
for, the next 7 to 10 days, and how are you going to feel at the end of, that week or 10 days?
Mhm.
that usually gets people's attention. That kind of thought experiment is frankly horrifying for a lot of my patients.
And
It would
then,
be.
I know Alan Gordon spoke at the PPDA conference, and Forrest Smith, amazing folks. And how do you feel about the technique, the somatic tracking, the pain recovery technique? Because somebody could be doing what, like the method that you said is to realize that how would they treat a child they were bringing up. That could be more of a heady thing. Okay, so I can't really go there. I mean, like I can't like ruminate about that. But if I have to practice my, focusing on my pain, understanding my pain, realizing I'm not threatened, how do you feel about that leg of the treatment?
Yeah, yeah, it's an ongoing debate in the field. I mean, it's the amazing thing about our field is that we have an incredible diversity of practitioners. People from all kinds of different mental health and medical professional backgrounds who have found their way to these concepts. And we all started, all these different places in the healthcare universe and arrived at a consensus around what patients with psychophysiologic disorders need. And we agree on probably 98% of how to diagnose and treat this condition. But one of the ongoing debates is around pain reprocessing therapy and emotional awareness and expression therapy and ISTDP, intensive short-term dynamic processing. There's a lot of overlap between all three of them. The differences mainly are around emotions. Pain reprocessing therapy doesn't get into the underlying emotions that much. It's mainly trying to alleviate pain, and by doing work on understanding where that pain is coming from. Once somebody's been through the diagnostic process and there's no organ disease or structural abnormality that explains their pain, then we know the pain is being generated in the brain. And we know that it's the brain is generating a danger signal, but that there isn't any actual danger, that the danger is coming from, someplace in the past or outside of us. And so we can tell ourselves there's no danger. We don't need to be afraid. We can ratchet down the fear. We can, when the symptom does flare up, we can notice it. We can do somatic tracking, which means we are aware of it, but we're not going to attach emotions to it. We're not going to attach fear to it, for example.
Fear.
We're just going to notice it and pay attention to it. And use that development of the symptom as a way to bring down our own fear and our own emotional reaction to that pain. And it works. I mean, it's a highly effective technique. It blows the previously available techniques completely out of the sky as far as their effectiveness. It was tested in a randomized controlled trial in the Boulder back pain study and had dramatic drops in 30 days in people's pain scores. People had been suffering back pain for an average of a decade. And they compared it with two control groups, one group that just kind of went along as they had been, another group that got these big injections directly into the spine. I mean, it's a humongous placebo. You can't get a better placebo than having something injected into your spine. And, this 8 sessions of pain reprocessing therapy achieved enormously better improvements in pain scores than even this massive placebo. So it's absolutely one of the best techniques out there. You compare it historically with studies of cognitive behavioral therapy, and the impact of cognitive behavioral therapy, which is everywhere in the mental health field, is next to nothing compared to pain reprocessing therapy. It hasn't been directly compared yet, but if you do historical comparisons, there's very obvious that pain reprocessing therapy is much better. Emotional awareness and expression therapy also has been tested by the gold standard of randomized controlled trials, achieves similar levels of outcome. And the main difference is that it gets into people's emotions, tries to uncover emotions that are there but are not being recognized by the patient. And consequently, since the patient is not cognitively aware of those emotions, the emotions got no place else to go but into the body, where they create symptoms. So to me, it's that's the form of treatment that I practice. I believe in going as close to the source of the illness as you can, and helping people recognize those emotions and then put them into words. It's a technique that can be used even if there's ongoing uncertainty about whether a person has 100% psychophysiologic disorder or 80% or 50%. That there are people out there that have a combination. They've got a certain amount of their pain comes from a joint problem or an organ disease or a structural issue, and a certain contribution is well, that's an interesting picture of myself there. I just froze on my screen. Sorry.
Oh, okay.
Hope you can still hear me.
Yeah, yes, all
We
good.
can, yeah.
I look like I'm having a stroke on my screen.
God forbid.
But I'm not. I'm perfectly okay.
Well,
But by getting to, you can work on people's emotions even when there isn't complete certainty about the source of the symptoms or the pain, even when there's not complete certainty about the relative contributions of one versus the other. You can still work on people's emotions. You can benefit them, their mental health, as well as their physical health. So to me, it's a more advanced and in many cases more effective form of treatment than pain reprocessing therapy, but it's also more difficult to learn, takes more experience. We're never going to have enough practitioners just because of the complexity of learning the technique. Pain reprocessing therapy, Dr. Gordon's book, or Alan Gordon's book, is called The Way Out, and it's something that people can teach themselves, and it helps a lot of people. But if it proves to be insufficient for a particular individual, then absolutely emotional awareness and expression therapy, or ISTDP, is where I would go next.
Point.
Would you also put up Fran's next comment?
Oh, I didn't see it.
It's so appropriate.
Yeah.
See, look, it's so simple. The things that hurt us as kids, like that means that my parents didn't trust me, doesn't it? In a way, yeah.
Good point.
It can add up. I mean, if it's just one thing.
Sure, but that would be the theme within her family system, wouldn't it?
Yes.
Yes. Yeah. So that gives us an insight into her family system, and then we'd actually be able to expose more things, and then they'd become integrated, and she'd begin to understand where she's coming from in her adult life, and then the need for the pain becomes subdued. Yeah.
Yeah, absolutely.
Thank you,
Fran, once we start having a conversation about these little things, people start to remember other little things.
Yeah.
I can remember, one gentleman, 45 minutes into the conversation, it suddenly all came together, and he realized that the only time he ever got praise from his parents was when he did something better than his brothers and sisters could do it. It wasn't enough to be the best in his class at something. He had to do it better than he had 3 siblings, and they were all very smart, very athletic, very accomplished, and he only got praise from his parents if he bested them all, which meant, that not very often did he get praise, which meant that his self-esteem was knocked down over and over and over again. And he had all of the personality characteristics that you see in people who've had what's called big T trauma. They were all there, even though his personal trauma would be characterized as little t. For me, I didn't see much difference.
Wow.
I think that's the research says the same thing, doesn't it? Yeah. Thank you, Fran. You've actually given us a great little background of what it's like
Yeah,
to be the recipient or the
yeah,
person experiencing chronic pain.
yeah,
So,
yeah.
yeah, thank you for your contribution.
You
It's
know,
been
and
really great.
many of the people, they, you'll tell them about the trauma, they'll tell you about the trauma, but they still doubt. There's this doubt, because the pattern is that they're so separated from the self, they're so disconnected from experiencing. And that's where some of these therapies, where what Rose will do, will have people go back and experience some of the, or someone will have pain in their leg, and Rose will say, well, who do you want to kick? So she'll help people get to the point of experiencing, not have to go through the trauma again, but to understand it, that you're okay. Like when people have post-traumatic stress syndrome, sometimes there's this docu-therapy where we interviewed this producer like Michael Galinsky, who would do documentaries, yes, movies on people that had trauma, and take them back to where the trauma happened and document it on the
That
film.
they're safe. Yeah, okay. He
Yes.
documented that they were safe
Yes.
now as adults.
Because
That's
they
what he was
left an
documenting.
experience traumatized.
Yes.
He went back and he made a movie about the trauma, showing that they're safe. And that was the healing. So it's kind of like we all have this narrative, this story, we've created this mountain.
But he also had that, like, that's that dolphin boy you're talking about.
Yeah.
He also had a whole year and a half of that boy being able to speak again.
Right.
And it took the interaction with the animal for the young man to feel safe.
Right.
So it's a bigger, it's not something you can sort of just do in a therapy sort of session.
No.
It's much deeper than that, because this young man in the story was it was a near-death experience of being beaten up.
Yeah.
And after that, he couldn't speak anymore. He couldn't tell. So the psychiatrist actually suggested that he goes down to the Red Sea to this
The dolphin
dolphin.
reef.
Yes. And he spent the time down there, and eventually he came back to himself. Yeah. But yeah.
And the other movie that we brought on the show was called Cut the Pain. And it was about an Army officer who left the tank to do some walking, and all his buddies got blown up in the tank. And of course, he got out of the Army, and he had enormous pain in his leg, but nothing happened to him. And he was sure that he had something wrong. And in the movie, he begged his parents and the doctors to let him cut it off. And he cut it off, and the pain was still there. And then he began to deal with the emotions. So
of letting he felt that he'd let his other colleagues down.
Right.
And then he also realized that he felt that he'd let his family down. And the story went right back to his childhood again, of how his self-esteem was damaged, injured, however you want to put it. Yeah.
And there's something called narrative therapy, and there's NLP, and I think they all have a place. And a lot of people don't get into the chronic pain because they have anxiety, and they go and they do narrative therapy or do NLP, and they get to deal with it before it turns into a tumor or chronic pain. And I think that it's our story. We created this, our imagination, and I'm bringing it up for a reason, because many of the people that have healed that I've met from cancer and MS and other, diseases, have done enormous amount of work with meditation and imagery. And so this could be, if like to some of the people, some of our listeners, there's our techniques are wonderful. I think they're fail-proof, but if they're not working, as you said, there's so many ways people are getting healed from hypnotherapy. I mean, everyone's so different. And this is why there are still many people not getting better. Can you address that, Dr. Clarke, with what, like,
Yeah, I mean, everybody is different, and everybody's at a different place along their path, and the degrees of trauma that people have suffered are fairly wide ranging. You know, some people have been through just enormous amounts, but at the same time, there's also resilience qualities that people have, but those can also vary by a huge amount. Some people are extremely resilient, other people not so much. A lot of that depends on whether they had counterbalancing positive experiences when they were children. Did they have somebody in their life who
right,
believed in them? It might be a neighbor or a teacher or a grandparent who
right,
made them feel that there was somebody who cared about them. That can go a long way toward offsetting chaos and dysfunction in your family home. So it's a wide range. People, different communication styles. When you do see a therapist, for example, it's so important that you connect with that therapist, that you and the therapist connect with each other.
very
And
important.
that doesn't say anything about whether they're a good therapist or not, or whether you're a good patient or not. It just is there a personal connection that
Good.
people
Connection.
have?
Yeah.
And if you don't feel heard, or if you don't feel like you're making progress after a certain period of time, it's perfectly okay to go and try and find a new therapist, somebody that where they do seem to hear you and you do feel like you're making progress and that you are talking about issues that are of concern and issues that you maybe haven't fully understood up to that point. And it can take quite a bit of trial and error with different therapists to find one that's going to be uniquely suited to your needs.
True.
Excellent point.
So, yeah,
Excellent
yeah,
point.
yes. Well, we've seen lots of people that have got different, um, like that hypnotherapy lady that healed that just through hypnotherapy, and yet others haven't. So it depends on the person, doesn't it, and the connection with the patient.
Yeah,
Yeah.
the empathy skills in this field, no matter
Totally.
what kind of practitioner you are,
Is it?
The bedside manner.
yeah, this is so important. The ability to, what I mean by empathy is the ability to feel what it's like to be another human being, because the majority of people with psychophysiologic disorders are experiencing emotions that they cannot put into words.
Wow.
So
Mm,
if you cannot put it into words, how are you supposed to know what's in there? I mean, that's words are how
exactly.
we communicate with people. And
Good point.
if you are, a skilled practitioner in this field, you can figure it out. You can read between the lines of what people are saying. You can understand that the emotions are there. It's kind of like looking at a shadow on the ground and figuring out what kind of object is casting that shadow without
Mm,
looking at the object. That's what, when somebody talks to you about their experiences in their life, it casts a shadow of their emotions on the ground, even though they're not speaking about the emotions, even though they're not showing you those emotions. You can see that shadow on the ground and figure out that those emotions are there. I mean, it took me
beautifully said.
Yes.
1,500 to 2,000 interviews before I could see those objects. So it's not an easy skill, but when you have that ability, it makes a huge difference in your ability to help people with PPD. And it doesn't matter what kind of practitioner you are. If you can see the emotions in someone, you can help that someone to see those emotions for themselves.
That's right. Yes. Would you mention also about self-reflection, how difficult that is? Because that's one of the other drawbacks to healing, isn't it? That ability to reflect that they're safe.
Yeah, I mean, if you've grown up in an environment that is not safe, then it's easy to take any even mildly adverse situation in your life and just um, extrapolate from that to something
Mm.
that is truly terrifying. Um,
Yeah.
and to shift from that into the ability to
Mm.
tell yourself that you're safe, convince yourself that you're safe, that's is a skill like any other. It takes time to develop. It's like learning a new sport from scratch. It takes
Mm.
lots of practice, lots of coaching to figure out how to do it.
And you just mentioned, like, when the doctor and the patient, there's empathy, the person can learn to do it themselves, because that's part of the healing and part of the treatment is self-compassion. And every doctor goes into the field being very compassionate about healing, and yet there's people like you who decide to go further and look deeper and be curious, as Rose would say. You're curious about what's going on here, and you called that psychiatrist Harriet and you asked her to look at your patient. Like, you have to look at, you had a childhood where you were taught empathy and you now utilize that in your life, and you've changed the face of medicine. You're one of the, the pathfinders. And I think many doctors have potential to be empathetic.
Yeah, I think they do, and I think it's a skill that can be learned. In my
Mm.
graduate school courses, I have spent 2 weeks on teaching people to develop their empathy skills, and I shouldn't just sort of talk glibly about empathy without defining it a little better. It's different than sympathy. Sympathy is where you feel caring for another person. Empathy is where you can truly feel what it's like to be that person. That's a different order of skill altogether. And I've incorporated that actually into the online course that we have at the ppdassociation.org or endchronicpain.org. There's an online course there that's based on my grad school courses where a couple of the modules are about
The one you do
helping
with
people
Jessica, you do with
develop the
Jessica.
empathy skill. Yeah, the one I
Yes,
do with our
excellent.
executive director,
Yeah,
Jessica
excellent. Yeah.
Shahinian. It's we spend a couple of modules on developing people's empathy skills. I give a sort of a case in bare outline, and then ask people to try to figure out what's going on beneath the surface, and then have a discussion about what is going on beneath the surface in those patients.
Wow.
Excellent.
Amazing.
Fantastic. Could we
Yeah.
give another plug for PPDA,
Yeah,
please? Dave?
it's
Yes.
Thank
first of
you.
all,
Can
I
you
had
go through the whole
I had
thing?
no idea that Forrest was
Mm.
involved. You have amazing people.
Yeah, the
Mm.
board of directors is incredible. It's now over 10-year-old organization, and we're just getting more and more support from all over the place. People calling us up wanting to make large donations toward the work that we're doing. We have, as I say, the online course. We've just completed the largest mind-body virtual conference ever that I know of. We had close to 380 people registered for that, 22 international speakers who are all experts with decades of experience who were speaking. The course was recorded so that people can still sign up for it, take it, and if they need continuing education credits, at least in the United States, they can get those. It's 12 hours worth of material from all these different speakers, and we've got the textbook. We've got a list of resources that are scientifically valid on the website. We have a couple of questionnaires that people can take in order to decide if they fit the context of a usual PPD patient. And it also can give people insight into some of the sources of their own, personal struggles.
Mm.
So that the questionnaires, serve a couple of different purposes. we also list the app. We're being in the 21st century. The app universe is out there, and then some of them have got psychotherapeutic intentions. Most of the psychotherapy apps are frankly not that good, but there's one called Curable that has incorporated, I've consulted with them for, close to 5 years now,
Yeah.
and they've gathered onto their scientific advisory board most of my colleagues that do this work, and they kind of scraped all the best ideas off of our heads and put them into a very, supportive and personalizable user interface. So I recommend that a lot as well.
I'm gonna put up Scott's question, and then I'm gonna run and get the book. It's on my shelf real quick. I'll be right back. Do you see the question?
Yeah, is it suitable? It's there. I got two books. There's one that's written for just patients everywhere called "They Can't Find Anything Wrong," and the second book is called "Psychophysiologic Disorders." And because it's it is intended as a textbook, but because it's jargon free, people who have who are scientifically oriented will find it valuable as well, and very readable, because like I said, we took all the technical language out of it, and I'm hearing a lot of therapists are prescribing that book now for their patients who want to get into the science, frankly.
But I want to just I want to say something to Scott and anyone who's listening. All this is amazing, but it has to be applied into your life.
Very well said.
It has to be implemented into.
It has to be taken off the page.
And they say we don't learn about stress on a yoga mat. We have to learn about it in a traffic jam, or talking to our child, or sitting there in therapy talking about your memory. This is where we get to practice, and it's the hard work. And as Rose named it, it's the path from the head to the heart, which a lot of us we bolt, we go the other way. So this is the road. So any of this stuff is amazing, but it has to be applied into every day for it to work.
Before we finish, could I also mention that, as Tova was saying about the head to the heart, in any of these therapies, in any of this chronic pain, there's a loving feeling that wants to come up. And that loving feeling is actually stymied by the pain. So it's stymied by the self-criticism. It's stymied by all the other things that we've gathered around ourselves. So underneath any therapy, any work, is always that loving feeling that you can actually interact with your family members or with your colleagues or whatever in a different way. So recognize that your chronic pain is about repressing some sort of feelings. And as Dr. Clarke said, it's usually about self-esteem. It's built on the lack of self-esteem, where you can't actually express yourself. It's pre-verbal often, and what it's wanting to do is open up that loving part of you that's had to be held back.
Yeah, the part of you that is self-loving. My patients are my heroes. I mean, they have come out of this wilderness that they were born in, that I spoke of earlier, and that meets the definition of heroic. That they have overcome a difficult mental or physical challenge for a good cause. That's heroic. I have a lot of my patients take an index card and write their name on it, and they'll say, Tova is a hero, ! And have them tape it to their bathroom mirror where they'll see it every day as a reminder.
Write in red lipstick. I'm
there
enough.
You go.
You're enough. No, and having low self-esteem does not mean you're weak. It means you're sensitive. And, they say that sensitive is the new strong. And Rose and I see it all the time. Sensitive is a quality that is a wonderful quality, and it can be channeled in a way that helps you, not hurts you.
Yeah, all the good qualities, all the strengths that people developed in order to survive those early challenges that you're still going to have those. You're just going to recognize, how strong you are. You're going to put down the 300 pounds of stress you've been carrying on your shoulders for as long as you can remember and longer. And then you're going to see how strong you are.
Exactly.
Wow.
Wow.
This show has been I know Rose and I, it has been just, every word has been just so really healing and informative and inspiration and education. We're going to put you up on Facebook Live for a long time. We're going to put this video on. We have it on our YouTube, so we'll send it out. And if any of your kids want to see what a great empathetic father and grandfather you are, if they forget, we'll send them this. And
Okay.
we really appreciate you coming on. You've been really our hero, and we love working
Thank you.
with you. And I always say Rose and I are going to be doing this till at least I'm 120, which is like another 40, 50 years. So we'll see you again.
Great. No, I and love talking to you guys. You're doing excellent work spreading the word out to people who need to hear it. These ideas take time to get out there. I like to point out that so many other seemingly straightforward and wonderful ideas that took decades to become common knowledge. The idea that women should vote, for example, in the United States took 72 years. The idea behind plate tectonics took almost 50 years. We commonly accept that the continents move these days, but the guy who came up with that was ridiculed. The 19th century, there was a guy who said surgeons need to wash their hands between cases. This was
that was the most important thing, wasn't it? Really.
And they just hounded him. The doctors of the day, 19th century Central Europe, they just felt insulted that he was saying that they might be responsible for disease in their patients. And they hounded him into exile.
Great point. So at some point, you're saying that what will happen is you'll go into a doctor's office and they'll say, "What's going on for you today?"
Yeah, I mean, it's like that doctor who came up to me at the conference and said, these concepts have put the joy back into my practice. And she was thinking of leaving medicine because 40% of the people who came to see her, she couldn't help. And then to find out that she could help them and that the rate of cure was the highest in her practice. She couldn't cure diabetes, cancer, or heart disease, but she could cure a lot of these folks.
Wow, amazing. Well, we're very happy to spend this hour with you. And so thank your family. And I'm glad I caught you. And it's just been, it's been serendipitous like that. This stuff happens. And I feel very blessed. Rose and I feel very, very blessed. We talk all week. We're so blessed.
Thank you, guys. You guys are great. It's wonderful to speak with you and to know that the word is getting out there. Thank you.
Great. Have a wonderful rest of the day. Bye, Rose. God bless.
Bye, Toba. Bye, Dave. Bye, everyone.